My name is Dr. Rafael Cruz. I'm an emergency physician. I've been involved in emergency medicine for over 10 years. 3 years after finishing my residency, I encountered the first patient that I couldn't intubate, meaning I couldn't place an endotracheal tube through the mouth into the trachea to help the patient breathe during an extreme situation or a surgery. When normal intubation fails, then a clinician finds themselves forced to perform a surgical airway, also called a cricothyrotomy or a tracheostomy. Without oxygen, irreversible brain damage can occur in as little as 3 minutes, and death can follow in as little as 6 minutes. During the encounter where I was unable to intubate that patient, I was lucky enough to have an anesthesiologist and an ear, nose, and throat surgeon. All three of us failed that day. Neither of us could intubate the patient, and all three failed at performing a surgical airway. The patient sadly died. This traumatic experience led me to extensively investigate and research how to perform a cricothyrotomy or tracheostomy. What I learned was that the existing cricothyrotomy kits were large, bulky, and had instruments that required assembly and a lot of familiarity. Even for someone who's familiar with them, they are typically going to take 3 minutes to assemble and to finally perform the cricothyrotomy. The alternative to a cricothyrotomy kit was a tracheostomy tray, which had hundreds of instruments to sort through while a patient was dying and turning blue. Neither of those two choices can be carried on one's person, and a teammate has to find them when minutes make the difference between brain death and human death or life. I finally discovered an elegant procedure and technique involving a tracheal hook and a scalpel. And subsequent to learning about this technique, I faced 2 more patients in the next 12 months who needed a cricothyrotomy. I was able to use the tracheal hook and scalpel to perform a surgical airway very efficiently and really easily. And this led me to the conclusion that it would be great if these 2 instruments could be combined into one instrument, and thus CruzCric was born. We developed a prototype and patented the device, the only pocket surgical airway device, CruzCric. It's similar to a luxury pen. Here we have it uncapped, and you see the scalpel blade. When we advance the tracheal hook, a sheath covers the blade, protecting the clinician. The tracheal hook is used to secure the trachea, allowing for easy placement of the endotracheal tube into the trachea while maintaining control of the trachea. Fortunately, when they perform this procedure, the endotracheal tube is still readily available, and they can place it through the incision they make here just below the Adam's apple into the trachea. So let's see how quickly we can do this. Uncap, feel the cricothyroid membrane, horizontal puncture, advance the tracheal hook, dilate your opening, and slide in your endotracheal tube. And we're in and we're ventilating. As you can see, it's a very quick, efficient procedure.